On February 2nd, an individual came back to San Francisco International Airport, was picked up by their spouse, and brought back to their house in Sacramento County, where they actually, fortunately, self-isolated themselves or self-quarantined. Were initially without symptoms, then developed some very mild symptoms of fever and cough over the last couple weeks. Went to their doctor's office, were tested for this novel new coronavirus, and it came back positive yesterday afternoon.
And so at this point, we do know that this individual flew into SFO, is
Right,
that correct?
right.
Not the Sacramento
Right,
airport?
they did not find the Sacramento airport. And it actually is a better situation than it might have been, because this person has been self-quarantining for the last 3 weeks, and quarantining their spouse as well.
And so talk to me a little bit about why that is so important and why this person probably made a good call.
Yeah. So, well, I'm not sure I've answered that question, but actually the person and the physician made a good call, because the physician took a good travel history, which is obviously something you want to do. And the travel was not, although it wasn't from Wuhan, which is where the epicenter of these cases are, it was from China. The person had self-protective equipment on the plane trip, and landed in San Francisco, and then was taken by their spouse to their house in Sacramento County, where they've self-isolated for the last 3 weeks. Although she had very mild symptoms, and it's still not known how contagious this disease is, because it's still being looked at very carefully by the Centers for Disease Control in Atlanta. But it's a good thing, obviously, that she'd been self-quarantining, because it's unlikely that anybody was really exposed besides potentially their spouse.
And then I heard you say like this person was wearing some kind of equipment on the
Right.
plane. What do you mean by that?
I don't know exactly what they were wearing, what they were doing, but they were doing things, appropriate preventive activities, like potentially wearing a mask, like washing their hands, like avoiding other people who may have been sick on the plane trip.
Okay, good. That's good to know. And then, as we talked about in that Facebook Live
Yeah.
video, we talked about what is the likelihood of that spouse maybe getting infected?
So,
Excuse me.
very good. So the spouse was being tested, obviously. I believe has been tested already. But because we don't know how infectious or how contagious this disease is yet, I can't really say what % chance the individual would be to get sick, especially because the sentinel case, the case that is actually positive, has very few symptoms, if any at all, and actually now it has no symptoms. So it's important to point out that the person will not be released from this isolation until there have been 2 consecutive negative tests from the CDC for the coronavirus, so people can be assured that the person will be kept under confinement, if you will, until these 2 negative tests come back. And when these tests will be done, we're not sure. Again, there's a lot of new things that are being learned every day by the CDC, and so how long until we should retest, we're not sure, but it'll probably be between a week and 3 to 4 weeks.
So what can we say about your guess of the timeline of when this person could be released?
So a week to 4 weeks.
1 week to 4 weeks.
Right, probably,
okay.
yeah.
And that's after 2 consecutive negative
Right. I
tests.
mean, regardless, it'll have to be 2 consecutive negative tests.
Okay. All right, that's good to know. Let's see here. And so,
Want me to give the flu thing again?
yeah. So
Give my flu stats again.
yeah, give me the flu stats.
So-
Obviously, as you said, people should be more concerned about the flu.
By far, people should be more concerned about the flu. We're still in the midst of a pretty significant flu season. The flu vaccine has just come out from the CDC that's actually fairly effective this year, prevents about 55% of cases, and reduces the severity in the rest of cases. So it's very important to get the flu vaccine. And it's important to point out to people how deadly the flu is, or how dangerous the flu is. 25 million Americans have gotten the flu this year already. 180,000 have been hospitalized, and 12,000 or more have died of the flu, predominantly elderly people and those with chronic underlying conditions. So it's very important to prevent the flu. It's still not too late to get the flu vaccine. and the preventive measures you take to keep from getting the flu, like washing your hands regularly, avoiding the emergency rooms where there are a lot of sick people unless you absolutely have to go, and coughing into the crook of your elbow and throwing away tissues regularly, all those sorts of things are good for both preventing the virus that causes the flu as well as the virus that's coronavirus.
And also to kind of narrow down on it, as same question I asked you on that Facebook Live, I'm sure the number one question we're going to get from our viewers is, at me living in Sacramento County, should I be concerned? Is there any risk for me?
There's virtually no risk. I mean, it's impossible to say there's absolutely no risk. There's still some things we don't know about the virus. One of the things we do know is that it's getting less deadly as time goes along, not because the virus is a less deadly virus, but because, well, yes it is, because one of the things that we learned is that as we go along, the virus, the illness is not as fatal, as deadly as it has been originally thought.
We can start that part over. I can just ask you that question one more time.
Okay.
Of just like, living in Sacramento County, should I be concerned?
You really shouldn't be concerned. The chances of being exposed are virtually non-existent. But in addition to that, it is probably not anywhere near as deadly a disease as it originally appeared. The reason for that is that there are a lot more people that are coming out that have been infected that had mild symptoms or no symptoms at all, and they're not people who've gone to the hospital or been seen in China. And so the people that are dying are a percentage of those who are very sick, who have made it to the medical sites, as opposed to the vast majority of people who are not. So it's likely to be a much less deadly disease as time goes along.
Great. What about, because I'm sure we're going to get this question too, what about folks that may have been traveling at SFO on February 2nd?
So that's a very good question. We do a public health department investigation. It's very similar to food outbreaks or to other outbreaks, where we track people. We go backwards from the individual Sentinel case, which is the case that is the single case now, and look back at the person's exposure to people on the plane, to people that could have been exposed when they were in China. And obviously it's fortunate that they apparently were not exposed to people besides the spouse here in Sacramento County, so that makes it a little bit easier, but there'll be a detailed investigation that's done.
So there's going to be an investigation on that.
Yeah.
I mean, do people have any reason to be concerned if they were flying on that day? Like, what can we tell those travelers?
To be honest, I mean, if you were on the airplane with this individual, who granted had used precautionary equipment, the chances are it could possibly be exposed to the virus, in which case they should get tested. So if there's anybody who knows, or they'll be notified that they were on that plane, they obviously should get tested, but the chances are very small that even those people will be infected.
Okay. Any other key takeaways? Did we miss anything? I know we covered a lot of bases here.
No, I think we did everything.
Got everything. We talked about the spouse. We talked about the flu. We talked about
flu, very helpful.
People's risk.
Yeah.
What happens next?
So the investigation is what happens, and we try and keep quarantining and isolating people who have come from China, who all are negative to this point, except for the one case, to try and keep people from spreading this condition should they eventually come down with it from exposure earlier on. But it's basically doing the routine public health work. So public health often doesn't get credit because you don't know about what it does in terms of preventing disease until something happens. And so we're spending a lot of time doing disease tracking and following up and investigating this individual and any other individuals that may have been exposed to folks both on the plane and elsewhere, who are called persons under investigation, making sure that they're tested. By the way, all the tests so far in Sacramento County, except for this one case, were all negative. But making sure that we stay in contact with these people to make sure that if they eventually do develop the infection, that we know how to track them.
Okay, and just to make sure I get the wording right, only the person that was infected or is infected is under a legal
isolation.
Isolation.
Correct.
And then their spouse is under
quarantine. which you would think is usually the average person, including myself, had thought the quarantine was actually quarantine is voluntary isolation or not legally enforced isolation. Isolation is actually legally enforced.